trial. So in Wajir, we randomly assigned the different intervention arms across 80 different clusters of villages. And in total, we had around 3,400 girls who were randomly distributed across the different arms, and they aged from 11 to 14 years old. So we carried out the baseline survey in 2015, and immediately after the intervention started for 2 years. The intervention itself ended in 2017, and then we carried out midline data collection activity. And then 2 years after the end of the intervention, we also carried out an endline data collection activity. The purpose was to see whether the effects we observed at midline were able to be sustained 2 years on. Next slide, please. So at midline, this is soon after the intervention ended, we went and we tried to evaluate what assets were gained by these girls. So we weren't looking at the impact in terms of early child marriage. We were more looking at the skills. So what we saw were significant improvements in primary school enrollment, and we thought this was mainly being driven by the conditional cash transfers. We also saw significant improvements in literacy and numeracy, gender norms and self-efficacy, and financial literacy and savings for the girls. And in addition, what we saw is the education results were stronger for girls who actively participated in the girls' empowerment sessions. So not only were the cash transfers successful, but if girls were able to participate in the safe space sessions, then the impacts were even stronger. Next slide, please. So then, as I said, 2019, we came back to see what the endline results were. What impact did we see 2 years after the end of the intervention? Next slide, please. So in Wajir, what we saw is significant. So this is specifically for out-of-school girls at baseline. So if a girl was out of school at baseline, we saw significant outcomes in increased school enrollment. We saw significant decrease in early child marriage and pregnancy. So in this bar chart, the green bars represent the control arm. So this is just the arm where girls were receiving only the violence prevention component. And in the blue bars, this is a combination of all the other arms. So the violence, education, health, and wealth components. So you can see the percentage currently enrolled in school, this is 2 years after the end of the program, was 45% in the intervention arms, but remained low at 16% in the control arm. We can see the percentage ever married. There was a significant 20 percentage point decrease in the girls who got married in the control arm compared to the intervention arm. So for 50% in the control arm to 30% in the intervention arm. And also in terms of ever being pregnant, we could see a significant decrease from 34% in the control arm to as low as 17% in the intervention arm. Next slide, please. So what are the program implications? What we see, or in summary, we see that working across sectors and at multiple levels of a girl's ecosystem is important to be able to achieve these outcomes in terms of delaying child marriage and delaying early pregnancy. We can also see that addressing underlying economic constraints at the household levels opens up change for the girl level outcomes. So then what do we want to do next? We now want to integrate AGIC components into county structures for scale. So specifically, we're working very closely with Wajir County, but we're also trying to target other counties that are suffering from high prevalence of child marriage, which were shown in the previous slides, which included Murgor, Homa Bay, and possibly
Daniel
Narok.
Muraithi, can you mute? Daniel Muraithi, can you mute? Sorry, Beth, continue.
Thank you. And we...
Any technician around, can you mute Daniel Muraithi?
Thank you. And we also want to... explore how to target the cash transfers to those who would most benefit. As we saw that getting girls back into school will have significant impacts on delaying child marriage and delaying early pregnancy. So thank you, and apologies for the background noise, but if you want more information about the AGIC study, this is the website, and you can contact either Karen Austrian, who's the PI, myself, or Faith Mbushi. Thank you.
Thank you very much, Beth, for such an insightful presentation on working around tangible interventions to address early marriages in Kenya. I wonder where the NCPG technicians are. Kindly mute or remove it. So that we are able to continue. James Macharia, if you are in charge of this session, technically, please mute Daniel Muredi or remove him altogether. Instead, I was the one who was muted, so I don't know. Something is wrong somewhere.
Probably is not even aware that he's unmuted, so I don't know whether if James is around. Yeah, he is muted now. Thanks.
Prof, you're muted.
You are muted. We can't hear you.
I was muted again by someone. I don't know from where. So thank you very much, Beth, for taking us through the tangible interventions that we need to address in order to deal with the phenomenon of early marriages in Kenya. Indeed, you have shown us how it requires a bit of work and trying different approaches in your empowerment cash transfer or empowerment approach, and showed us how RCTs could be used here. I was excited at your forearms, although I'm not very much a good believer in RCTs in social interventions, partly because addressing underlying social ecosystem or cultural issues might require more time. But there you are able to show us how that was able to increase primary school enrollment, increase literacy and numeracy, and also to address certain gender norms and self-efficacy issues. And especially that if girls are able to make some saving culture, they are able to plan for themselves. And in the process of planning for themselves, they are able to address certain that are tied to close school enrollment and being ever married. Of course, a number of studies had previously shown that the more you keep girls in school, the more you delay marriage and maybe age at first birth. So, ladies and gentlemen, let's go back to our discussion issues. And I think I thank all the three panelists for having brought up the issues and the way it was well crafted by Professor Ikamari, starting with giving us the situation, the prevalence of child marriage in Kenya and across counties and across the sub-Saharan region, and giving us this very nice example of Rwanda being able to implement the various laws and legislations and policies that has acted as a deterrent. Kenya is not short of those pieces of legislation, ranging from the Children's Act, the Marriage Act, and even the Sexual Offences Act. And as Professor Ikamari rightly put it, we are also signatory to several international covenants that bind us to implement those rules. We also have the anti-FGM law and all that. And Caroline went ahead to show us actually the impact of child marriages on children, the whole range of issues that come up with early marriages or child marriage, and how FGM is a precursor to child marriage, and the poverty, deprivation, insecurity, social-cultural practices, and a whole range of push factors that actually make girls vulnerable to child marriages. The humanitarian crisis that sometimes they find themselves in, and the challenges that come with the child marriages, such as economic deprivation, sexual exploitation, health issues, and survival issues, and how this impacts on achieving our Agenda 2030 and achieving the SDGs that we have committed ourselves to. I think what has not come out, and people have also discussed and asked a lot, is the extent to which child marriages affects boys. I think that has not been addressed very much. But let us hear from the floor. There is a very fast question we'll give to Professor Ikamari. The issues that were raised, you try to address them. If some people on the floor still have some, let's have Professor Ikamari address some of the issues that were raised, especially the fact that your data will need to be updated, and that we may have made some improvements since the data that was collected, and that the people who work on these issues have a feeling that the 2021 KDHS might have a better picture. Professor Ikamari. Professor Ikamari, are you still with us?
Yes, very much so. I'm in the house. Yes, I agree with that we need to get more recent data to confirm what we are seeing. 2014 KDHS is now dated in many respects, but that's the most current we have. That's why we are relying on it. But there is mixed, what do I say, mixed situation on the ground. In certain areas, you get that the child marriages are on the decline. In the other areas, there are indications that it's actually on the rise. Certain areas. So particularly those areas that are poverty-stricken, you get those impressions on the ground. And in some counties, you hear people talk casually about it, that there are actually very many girls now who are mothers, yeah? Young girls who are mothers, and their situation is worsening by the day. So there are those situations that make give us a mixed, not quite sure where we are headed. And then some members have said here that the COVID-19 may have added more, more harm to a situation that was already deteriorating, and we need data at the national level to know what is really happening. And also, Chair, you recall during when schools opened, and also recently during the KCSE exams, and even actually are recording significant improvements in some of the outcomes. For example, delay on the onset of sexual activity among girls, delay in the onset of marriage, and the issues of retention in schools. Those are some of the that number of agencies are recording. For example, I was associated the project in Cliffy for quite a while, almost for 5 years, and a number of were able to see those improvements taking place in some of the sub-counties in Cliffy. So there's a lot that's happening, but all these things need to be documented and shared, some of the best practices across the country. There are a number of agencies here that have been implementing, and they have very good practices, best practices that could be shared, even in the area of comprehensive sexuality education. There are very good practices that could be emulated, particularly in areas, in counties that have very high incidences of child marriages. I see on the chart the issue of the boy child. We try to indicate here that child marriages are essentially a girl-child issue, because there are very few boys who get married before the age of 18. Very few, as the data indicated that only 5%, about 2 point something percent. Yeah, very low rates compared to 23, among the same age group. So you can see that yes, there are isolated cases here and there, but nationally, the numbers, the figures are very low. Okay, and also traditionally, you had to prove yourself that you are able to have a wife before you are allowed to marry. Okay, so those are some of the challenges, and let's also appreciate that the challenges we have now, that you are on your own, basically. So for you to have a family, you need to be strong economically. Otherwise, you'll be deselected by many of the young girls, many people who are in the marriage market. Okay, so those are realities on the ground, and but we need more information about about the boys in terms of how they are really affected. Those who get married, early, before the age of 18. Yes, there's another issue here, that what's the population in terms of the numbers. I have not done it here, but it can be done to get the number of, in terms of the numbers affected using the KDHS data and extrapolating it to the population, nationally. That can be something that can be done very easily, so that we have these figures. Yes, I see those questions by Caroline Murgor, and yeah, that's okay. I'm in agreement that we need to look at the boys and do something about it. Yeah. Now, there's also something that was alluded. Maybe I take the disadvantage of being on the floor. The issue of FGM. Yes, the KDHS data does indicate that women who are circumcised, who have gone through this FGM, are more likely to marry early or have a child marriage compared to those who have not been. In fact, the analysis I've done, which I didn't include in the slides there, shows that those who are that 6% of those who are married, who have undergone FGM, got married before the age of 18, compared to only 20% among those who did not undergo the practice. So you can see there's a big gap that we need to ensure that we reduce FGM in the practice among our communities. Yes. So I don't know what other question I have here. I don't seem to.
Yeah, I think you have addressed them for
Yes.
now, Prof.
Thank you.
And,
Thank you. Thank
we
you.
are racing against time. Caroline Murgor is on the floor now for any other questions that have been that can be raised.
Yes, thank you very much, Chair, and thank you, Prof. I think a lot of the issues have been addressed by Prof, and one of the issues that keep coming up is on the issue of the boy child. I think we also need to really emphasize on that data and statistics, because if we're going to reap the demographic dividends, we're looking at issues of gender equality, and gender is both male and female, women and men. It's not just a women issue. Then we need to ensure that we factor in the issues around social and gender norms as well that affect some of the practices that are ongoing, and one of them is child marriage. And I think a key, one of the, and what is coming out more in the presentations that are happening, is that education actually has a direct impact on determining whether a girl or a boy will be married at a young age, and also in terms of improving their overall well-being and their health and well-being in general, and also just basically breaking that cycle of poverty that is there. So I think as we looking at the outcomes of this leadership conference, we need to come out with clear impacts of how do we then are able to inform policy and programming, so that both at the national and county levels, we put in place policies and programs that actually address the well-being, the whole well-being of boys and girls in general. Thank you very much.
Yes, thank you very much. And now we have Dr. Kangwana. I saw there were issues around why Wajir and Wajia and questions like
Thank
that.
you. I think it was just one question as to why Wajir and can the findings be replicated elsewhere. So Wajir was selected by the funders, specifically DFID or UKAID wanted us to work there. And now we're trying to, now that we've come to the end of the RCT, we want to now try scale up the intervention in other similar counties. So Mandera, we're thinking possibly Narok. So we're in the process of working with the county governments and trying to look for funding to see whether scale up is possible and if we can evaluate it using a less stringent study design. Thank you.
Yes, thank you very much. Just to weigh on the issue of boys working with orphans and vulnerable children, especially children that were orphaned due to HIV/AIDS, we came across a number of boys who are forced to marry fellow orphans at an early age. So it may be, as Caroline suggests, maybe need to look into that directions. And I know of a number of other anthropologists working in communities who have come across boys who have married early because of orphanhood. So do we have any other questions from the floor before we wind up this? I don't see any question on the chat. If there's any that can be raised on the floor. Okay, none seems to be coming. I think I want to thank all the panelists for raising the pertinent issues and for indeed providing us with information and data and giving us the magnitude of child marriage in Kenya. I think of importance and takeaway home is that despite all the legislation, having a very nice legislative framework, Kenya is still having child marriage going on at a rate that would fairly be described as alarming, and this would be something that needs to be addressed for us to be able to benefit from what the demographic dividend that was alluded to earlier in the presentations. In terms of the interventions, we have been told that we need interventions that address the girls' eco-social system in which they live, addressing the girls' context in totality for us to be able to make them empowered in order for them to be able to be enrolled in school and be able to make certain decisions. But also it does appear that this cash empowerment approach also tries to address a number of livelihood challenges that sometimes child marriages in this session. So there will be need to continue to improve programming, also to look at different kinds of interventions. We've been shown an example of how RCTs can help us look at different things within different arms. They are always good at the design, but require very good monitoring aspects so that we are able to get the results. So thank you all for this. I think this has been a wonderful session. We have come up with nice ideas, which I hope have been documented and will be taken up by policy groups and intervention groups. Thank you all. Bye.
Thank you very much.